Hello, my name is Hiram Rivas Perez. I'm the Pulmonary Critical Care Program Director, and I'm going to go over the expectations for our fellowship, including our clinical rotations, research rotations, and educational curriculum. We are a moderate-sized division that is currently in the process of expansion with the acquisition of several hospitals in Louisville and outside of Louisville. Our division not only includes faculty and fellows, but also research coordinators and staff. And this is a picture that composes most of our department. You can access the biography of all the faculty through our website at the universityoflouisville.edu, Pulmonary Critical Care Division. Just to point out a few important faculty members here, Dr. Mohammed Saad is the division chief, Dr. Rodrigo Cavalasi is the ICU director, Dr. Karim Al-Kirsch is the pulmonary hypertension director, Dr. Gahar is the IP director, Dr. Juan Guardiola is the section chief of pulmonary at the VA hospital, and he's also the sleep program director. Dr. Alan Ramirez is the lung transplant director. I'm Hiram Rivas, I'm the program director as well as the obstructive lung disease program director. Dr. Suleiman is the ILD director. This year we're going to have the addition of two more faculty, Dr. Tariq Damad, who's an interventional pulmonologist, and Dr. Rania Abdullah. In addition to our main core faculty, we have faculty from other divisions that are important to the educational curriculum. Dr. Reed is the chief of radiology, and he's responsible for the teaching in the case conferences for radiology, x-ray, and CT scans. And Dr. O'Hagan is a peds pulmonologist that is mostly focusing on cystic fibrosis, and he's part of the CF program. Currently, we have 10 fellows. For the next academic year, we're planning to match for 3 positions. We have 3 senior fellows, 4 second-year fellows, and 3 first-year fellows. Our fellowship is based mostly on 3 main hospitals. The University of Louisville Hospital is our primary teaching hospital at full capacity, 404 beds. Our main rotations here are the medical ICU and console service. The medical ICU team is composed of an attending fellow, residents, and interns. It's usually a very busy service, and specifically during the flu season months. We also have our inpatient console service that becomes an IP service as well. Is where the fellows get to do most of the procedures with Dr. Gahar. Our second hospital is a Jewish hospital, which is a transplant hospital. Transplants done there are solid organ, liver, kidney, lung, heart, hand, and also islet cell transplant. We have 2 main services there. The medical ICU, which is a little different, is composed of 2 separate teams who run the ICU. One is nurse practitioners with an attending, and the second team is an attending, a fellow, and nurse practitioners or physician assistants. We occasionally have family medicine and internal medicine residents rotate there. We have a console service that also runs the inpatient pulmonary service. The inpatient pulmonary service includes patients with pulmonary hypertension, cystic fibrosis, and lung transplant. Some of our clinic patients that have any complications of their chronic diseases that need to be hospitalized get admitted to the Jewish hospital under our care. For example, an asthma exacerbation or COPD exacerbation. Within the Jewish hospital, there's an LTAC called the Kindred Hospital. We are responsible for a handful of consoles in any given week, and the consoles are for patients that are chronic ventilators. Fraser Rehab Hospital is connected to the Jewish hospital, and we're also responsible for some consoles, so patients with stable lung diseases undergoing rehab. Norton Hospital is a separate private entity. I include it here because we have some privileges there, specifically when we get referrals for lung transplant patients or possible lung transplants. Our third hospital is the VA hospital. It's a smaller hospital, approximately 100 bed at full capacity. It's about 3 miles from our main medical center here in downtown Louisville. We have all the specialties there at the VA hospital. We have an ILD program, a lung cancer COPD program, an IP program, as well as a general pulmonary program. Our main rotations there are the ICU, which in the ICU is a similar composition as the university ICU that includes residents and interns and attending. The ICU there includes a step-down unit. In addition to that, we have the inpatient consult service, which also has a fair amount of procedures due to the high incidence of lung cancer in our veteran population. We have a heavy ultrasound curriculum. It was completely designed back in 2017. We have in-classroom sessions where the fellows practice the ultrasound techniques and review several images in classroom conferences, but we also have bedside teaching as well. The fellows are also responsible for the teaching of ultrasound and with the house staff and some of the internal medicine faculty as well. As I said before, we have all this specialty, although we are moderate size division. We're currently in the process of expanding. We have a lung transplant program, a pulmonary hypertension program where we do our own right heart caths, as well as ECOS catheter placements. We have an ILD program with several clinical trials in pulmonary fibrosis and sarcoid. IP program with an IP fellow, which is a plus for our fellows, and they get to do a lot of procedures during the 30 years. CF program, sleep program, and then last year we started a lung volume reduction program with the endobronchial valves, and we are second highest center in the country of valve placement. The research expectations for the fellows are very active with research. In 3 years, they get to do from 6 to 8 months of research, depending on what the career goals for the fellow is. Normally, fellows present at the national meetings, American Thoracic Societies, Society of Critical Care Medicine, and Chest Medicine. All the fellows are supposed to be part of QI projects. Currently, we have Sepsis Response Team Project, Vent Weaning Protocol, Nutrition in the ICUs, oxygen prescription for COPD populations at the VA. The research expectation for the fellows, they're supposed to have a project that they are able to accomplish in the 3 years and be able to submit a manuscript from that project. And in addition to that, the fellows are supposed to present at least once at a national meeting. During the first year of fellowship, it's very heavy clinically. All the fellows go through a research exploratory month where they get to meet all our faculty and faculty outside of the division, and they get to design a project and figure out a mentor and a mentor panel that is going to be their team for research for the next 3 years. Not only we stay here, we have several other community outreach. This is more of an idea what we did a few years ago with Cystic Fibrosis Family Day, Lung Cancer Walk, Airbenders, which is an asthma support group. This year it's been limited due to the coronavirus pandemic. Hopefully when this is all over, we can go back to doing all the outreach community activities that we've been doing for many, many years now. The fellow also are involved on a lot of fellow-led projects. The fellows are responsible for some fellow-led projects. In 2017, we started recording our lectures with the Internal Medicine Division, and in 2018, we launched the Louisville Lecture, which is a series of pulmonary critical care sleep lectures that are available in free access to the public, and we had several views throughout the world. We also designed an ultrasound curriculum for the internal medicine residency. A few fellows developed a resident critical care manual, which is an easy reference of what to do in difficult situations in the ICU. And in addition, we also are training the ultrasound for internal medicine students. Louisville has a lot of things to do. The big thing here in Louisville is the Kentucky Derby, which is in May, and all the festivities associated to the Kentucky Derby. And there's some interesting fact about Louisville. You can access us on social media through Facebook and UofL Pulmonary Critical Care Twitter. Please like us on Facebook and follow us on Twitter. The Louisville lectures can be accessed to www.louisvillelectures.org PulmCrit folder. You will have access to all our lectures that we recorded over the past 2 years. Lastly, our educational curriculum, it starts with a pulmonary med school, which is the first two to 3 weeks of July. The new fellows do not have any clinical responsibility, no clinics, no call. It's all lectures and SEAM sessions. We go over endotracheal intubation, chest tube placement, central line placement, and we also go into mock codes. We also have an introduction to ultrasound with some of our senior fellows. In addition to the pulmonary med school, we have 3 days where we have 1 hour lectures. We have core lectures on Tuesday, case conferences on Thursdays, which are chest x-ray and ultrasound conferences. And then on Fridays is where we have our journal clubs or pathology conferences or multidisciplinary discussions of ILD and lung cancer. And then we try to keep the wellness of our fellows with several activities outside of work. I appreciate the attention. I hope to get to meet you soon.